Hello, everyone, and welcome to another live. So today, as you can see, we have a special guest I'm going to introduce in a second, but we're here to talk about Medicare. And if you don't already know, there is enrollment season that is ending March 31st. So we wanted to make sure that you are equipped with everything you need to be able to make informed decisions about your Medicare plan. So today, I'm thrilled to welcome Ari Parker. He's a Stanford trained attorney, among other qualifications that he has, but he's a Medicare, he's a known Medicare expert, and he's also the co-founder of Chapter Medicare, who we've partnered with recently. So he's also an author of an Amazon best-selling book, which I am going to bring up right now. And the book title is It's Not That Complicated: The Three Medicare Decisions to Protect Your Health and Money. So, Ari, we're thrilled to have you here. Welcome.
Thank you so much for having me, Kwame. I'm looking forward to addressing any of your viewers' questions about Medicare.
So, we want to make sure that this is a very interactive session. So, this is about Medicare. There's an open enrollment period that is ending at the end of this month. So, I want you to type in your Medicare questions in the comments, and Ari will do his best to address them and we'll bring them up. But first of all, I want the audience to, so you guys, I want you to tell me how comfortable you are right now with Medicare. So go in the chat, and if you feel very confident, put a number 5. And if you don't feel confident at all about your Medicare knowledge, then put a 1. And then if you're anywhere in between, then pick a number between 1 and 5. But I want to get a pulse on how confident you are about knowing what Medicare is about. So to get started, Ari, why don't you tell us, first, you are the co-founder of Chapter Medicare. So why don't you tell us a little bit about your company, what you guys do, before we dig in into what Medicare is about and what the 5 things that people need to know before they make decisions about their Medicare plan?
Yes, I'm sure your audience is wondering, who is Chapter? How can they help me?
Right.
Chapter is the only independent, unbiased Medicare advisory. We evaluate all your plan options, and people don't realize there's hundreds of insurance companies offering thousands of Medicare plans, thousands. And the right one for you depends on the zip code that you live in. And at Chapter, we evaluate all of your options. Now,
Awesome.
please.
No, go ahead.
The inspiration for Chapter, Kwame, came from helping our parents. My mom got laid off during the pandemic, and she needed help choosing the right Medicare coverage. And she couldn't get answers to straightforward questions that she had. Not to mention, she was being bombarded by direct mailers and unsolicited phone calls. So we knew that there was a huge opportunity to help the 70 million Medicare beneficiaries that need to choose the right coverage to cover their healthcare needs.
Right. Right. No, awesome. Yeah. And one of the things that you mentioned, which I'm going to bring up later, is the plethora of options that are out there and how hard it is to choose a plan. So if you're just joining us, we are with Ari Parker. He's a Medicare expert that is going to help us walk through the 5 decisions that you need to think about before you choose a Medicare plan. If you're just joining us, we are also asking you to give us your comfort level about Medicare. If you think you really understand what Medicare is about, put a 5. If you're not that comfortable, put a 1. And then if you're in between, just pick a number between 1 and 5. So Ari, why don't you get us started on what is Medicare and who is it for? Because we have people who are under the age of 65 who haven't gone on Medicare yet, and they're thinking about their options. So it's good to just get a baseline of what is Medicare and who is it for.
Yes. So Medicare is health insurance. It's commonly for older aged Americans. However, if you've received cash disability benefits for 24 months and non-consecutive is okay too, then you can also receive Medicare. So many of your viewers may have Medicare and Medicaid. Medicaid is for low income. Those two systems are compatible with each other, and many people don't realize this. So you can have Medicare by way of turning 65 or being past age 65 and coming off work-provided coverage. And you can also have Medicare by being younger than 65, but having received cash disability benefits for 24 months.
Right.
So that's who can have Medicare.
Okay. And I want to bring up, I mean, I brought up your book, which is a great resource for people to learn about Medicare. It's not that complicated. In the book, you talked about a pizza parable that you use to explain the three parts, or I mean, there's four parts of Medicare, but you're talking about part A, part B, part D. So can you really explain what that is about?
Sure. To go over the pizza parable, first, I need your viewers to understand a little bit about Medicare.
Right.
So you can picture Medicare as a three-legged stool, three parts. Part A is your inpatient coverage. What happens to you when you're at the hospital? It means you have a wristband. If you don't receive a wristband when you go to the hospital, it means you're being held for observation, which Medicare doesn't cover. The second leg of the stool is everything outside the hospital. Visits to your doctor, lab work, x-rays, even durable medical equipment like a wheeler or a walker is covered under the second leg of the stool. And then the third leg is drug coverage, as you mentioned. Now, each of these legs correspond to a part. So your hospital coverage is Medicare Part A. Your outpatient coverage is Medicare Part B. And then finally, your drug coverage is Medicare Part D. D is in drugs.
Right. And so for people who are getting ready to enroll or consider their Medicare coverage right now, they know that there is original Medicare and then there is other forms of Medicare. Can you make a distinctions between, because I get a lot of people come in the comment and say I have original Medicare, and then other people are saying, what does that mean? Can you make the distinctions between original Medicare and how the other parts also came about?
Yeah, it's a great question because people assume that if they have original Medicare, then they don't need anything else. What many fail to realize, though, is that Medicare is only partial health insurance. It only covers 80% of your costs. And guess what? Owing 20% of a very large hospital bill can be thousands of dollars. So that's why many Medicare beneficiaries, including your viewers, choose some type of additional coverage. And the good news here is that there's only two types. And so this is where the pizza parable comes in.
Okay, do you want to go into the pizza parable?
Yeah, so forget about Medicare health insurance. Assume that the government has created a national pizza program. And you can use it anywhere you like, and it covers 80% of your pizza tab. You still owe 20% of the bill, though. And it covers you at thin crust pizza shops, deep dish shops, artisanal fancy pizza shops, let's say, but you still owe 20%. And so the question is, what type of coverage are you going to choose to cover that 20%? And so you can choose a type. There's only two types to choose. So even though there's hundreds of health insurance companies offering thousands of plans, we can broadly sort those thousands of plans into one of two types. And so type one is called Medicare Supplement. And this sits on top of your original Medicare. And it covers the 20% that you'd otherwise owe. So it works nationwide, it's networkless, and it allows you to go to any provider who accepts Medicare. The second type of additional coverage is Medicare Advantage. Medicare Advantage is offered by private insurance companies and is a replacement for original Medicare. This comes with network restrictions. So if you're on an employer coverage and you have an HMO or a PPO, this will feel familiar to you. And what many people like about the second type of coverage, that is Medicare Advantage, is that it's typically lower cost than a Medicare supplement. 65% of Medicare Advantage plans offer a $0 premium. However, you still owe your Part B premium to the government. And the Part B premium for this year is $185 per month.
Okay, so no, that explains a lot to me. So now that we are in the enrollment period, a lot of people get confused about, there are two different enrollment periods for Medicare, and people get confused about, okay, what happens if I miss my initial enrollment period and the enrollment window? What are the consequences of that?
Missing your enrollment period is highly consequential because if you need to be on Medicare and you don't sign up timely, then what are you going to do for health insurance? And there's worse news. There's also a late enrollment penalty. In fact, there are two. There's one on your Medicare Part B if you don't sign up timely, and there's a second on Medicare Part D, your drug coverage. Right. So it's really important to know what your enrollment period is. If you're turning 65, then the time to sign up for Medicare is 3 months before the month in which you turn 65. So if Kwame's birthday were December 23rd and he were turning 65, then Kwame would need to sign up in September. And as long as he signs up in September, October, or November, his Medicare will begin December 1st. It always goes to the first of the month.
Okay. And then we're in another enrollment period now for Medicare Advantage. What does that mean? And when does that open and end?
So people who are already on a Medicare Advantage plan have an opportunity to adjust their coverage before the end of this month, March 31st. This is called the Medicare Advantage Open Enrollment Period, and it allows you to make adjustments to your existing Medicare Advantage. So you can choose a different, let's say you go to the doctor, or you went last month and you were surprised to learn that your doctor is not in network. That is a code red. So this enrollment period would be your opportunity to adjust your coverage and find a plan that has your doctor in network. Okay. Let's also say you go to the pharmacy and your prescriptions are incredibly expensive. Again, this would be your opportunity to find coverage that meets your drug needs. Now, you can also use this period to go back to original Medicare. And for some of your viewers, that's going to be something that they ought to consider if they need more flexible network-less coverage.
Right, right. And earlier, one of the things you talked about, I want to get to before I forget, you talked about gaps in original Medicare. So what are some of the common gaps? Because I get a lot of people come into the comments or, will write to me and say, okay, I have original Medicare. I don't need anything else. And there are gaps, but I don't think people realize what those gaps mean. Can you give us examples of what original Medicare gaps are and how they can be covered?
There's a big gap. There's a 20% gap.
Right.
Original Medicare only covers 80% of your medical expenses.
Okay.
What's more, original Medicare doesn't come with prescription coverage. It doesn't come with Part D. Though Part D is technically voluntary, if you don't sign up for it through a private insurance company, you will face a late enrollment penalty unless you have the option of coverage that's at least as good as what you would have received from Medicare Part D. Right. So those are two significant gaps. And in order to help fill those holes, that's what Chapter is here for. We help you evaluate all your plan options based on your doctors, your drugs, and your priorities, what's important to you. Kwame, I should also mention that there are some things that original Medicare just doesn't cover at all, and you brought some of them up. Dental, vision, and hearing isn't covered under original Medicare. And so to cover dental, vision, and hearing, and other things that might be important, like transportation or over-the-counter benefits, this would be a good use case to consider a Medicare Advantage plan.
Okay. So now that we're in Medicare Advantage enrollment period, and you guys are an advisory company, I've been talking about the services that you guys provide quite a bit, that you guys are an unbiased, free resource that our users can use. Can you give us a little bit of experience on if somebody calls Chapter or they fill out the form, what kind of experience do they have with your advisors?
When you call the Chapter team, you'll be paired with a senior Medicare advisor who uses our software to evaluate all your plan options based on your list of doctors, what providers you go to, what institutions do you want to go to if you develop a chronic condition, let's say, your list of medications. This really matters in terms of pricing as well, because if you're on a brand name or generic, the difference can be huge in cost. And of course, what pharmacy you like to go to. And then you'll have a discussion about your healthcare needs, and they'll help you sort whether Medicare Supplement or Medicare Advantage is right for you. They'll also go over whether you might qualify for Medicaid, let's say, if you're low income, or they'll check whether you already have Medicaid. And if that's the case, then we'll find a plan that coordinates benefits between your Medicare and your Medicaid.
Awesome. Awesome. So one of the things that we've talked about is Part D. I know drug cost is a huge, huge expense for a lot of seniors. And there's been a lot of changes about that. And you said that original Medicaid does not cover that. So it means that that's something that, seniors have to go out and get. So can you speak to Medicare Part D, what seniors need to think about when they are choosing a Part D benefit? And most importantly, there's been a lot of changes around Part D, out-of-pocket costs. So I want you to just go into explaining what we need to know as we're making decisions about Medicare Part D.
The biggest change that your viewers need to keep in mind is that there was a maximum out-of-pocket cap on Medicare Part D that went into effect January 1st. And this is very significant because previously there had been no maximum out-of-pocket on your viewers' drug costs. Now, for the very first time, there's a $2,000 hard cap. So for your viewers who are on expensive brand name medication or specialty medications that fight cancer's metabolic pathways, for example, there are some incredible pharmaceutical innovations that have happened in the past several years. This change is huge because if they sign up for the right plan and that plan covers their prescriptions, then it's subject to the $2,000 hard cap. But what's important is making sure that they're on the right plan. And that means evaluating all of their options. Because if they just sign up for a plan that doesn't cover their prescription, guess what? It's not subject to that $2,000 hard cap that I mentioned.
No, that's an important point to know. And so being in the right plan is critical here when it comes to Medicare Part D. So I want to tag on.
Can I add one more thing?
Yes, absolutely.
We've talked about Medicare Part D in isolation and also as part of a Medicare Advantage prescription drug plan. Right. So I just want to clarify that point for your viewers.
Okay.
If they're on original Medicare, then signing up for a standalone prescription drug plan would be the way to get their prescription needs covered. However, there's a type of additional coverage called Medicare Advantage, and the vast majority of these plans come with your prescription drug coverage bundled in. That is, it provides Medicare Part D through the all-in-one Medicare Advantage plan.
So just so that I understand it for myself, if you're on original Medicare, you have to sign up for a Medicare Part D plan in order to get prescription drug coverage. However,
that's right.
If you are on a Medicare Advantage plan, there are some Medicare Advantage plans that already come bundled with prescription drug coverage.
Correct. Okay. And there's actually, in most people's zip codes, we're talking about dozens and dozens of Medicare Advantage plans. And the right one for someone who's watching this will depend on your list of doctors, your list of drugs, and what's important to you, your priorities.
Absolutely. And which is why, guys, we've been talking about chapter all month and last month about why it's important to have a medical advisor that understands the ins and outs of Medicare and actually sees all the plans and will be able to then help you pick a plan that suits your needs and your budget. So talking about reevaluating Medicare plans on an annual basis, it is advised that, you know, if you're on a Medicare plan, it's important to look at it every year, even during the open enrollment season. Why is evaluating your coverage important? And if you don't do that, what are some of the risks that you expose yourself to?
The big reason is because the plans change every year. The Medicare Advantage plan that you're on might have a different network of doctors for the upcoming year. In fact, your plan's network of doctors might even change mid-year. The second reason is because of that change we mentioned to Medicare Part D. The institution of the $2,000 hard cap is a big reason to review your coverage because we need to make sure that every prescription you take is covered by the plan that you choose. And so that's a second reason to review your coverage. And then the final reason that I wanted to mention, Kwame, is that there's dozens of different Medicare Advantage offerings depending on where your viewer is listening to this.
Right.
And there's lots of competition. So though you might have picked the best fitting plan for your needs for last year, there might be a new entrant to the market for you to consider.
Absolutely. And guys, if you're watching this live, you can type in your questions and we'll be happy to answer them. And if you're watching the recording of this, you can still put in your questions because we'll be able to get answers for you later. So let's talk about mistakes because the title of this live is the 5 common mistakes that people make when choosing a Medicare plan. And you've seen them all. You guys have worked with a lot of seniors on their Medicare plans. So you probably have, you know, the biggest hits. But what are the 5 common mistakes that you see, you know, people going into Medicare and choosing a plan, what are they making? How can they avoid them?
The biggest mistake we see is people missing their enrollment deadlines. If you're getting close to Medicare age, that is, if you're turning 65 and you don't have the option of being on yours or your spouse's work-provided coverage, which here, for the purpose of delaying Medicare, means 20 employees or more, then you probably need to enroll in Medicare. And the time to do so is 3 months before the month in which you turn 65. So that's one thing that I wanted to mention. Then the second mistake we see is people assume that original Medicare is 100% comprehensive. You know, at this point, it only covers 80%. So you need some type of additional coverage, or you ought to consider some type of additional coverage to provide for your hospital, medical, drug, and other additional benefits that might be important to you. And then the third mistake, and Kwame already mentioned this, is not reviewing your coverage every year. And the time to do so is during the annual enrollment period, which is from October 15th to December 7th. So those are 3 common mistakes we see. And I'm happy to get into a couple others as well.
No, you've given us plenty. So now I want to talk about, how should someone's health status and health needs influence the Medicare decisions that they made, especially when it comes to the kind of advantage plans that they get on, and making sure that there's no surprises. Because one of the things that have been in the news lately, and I'm sure you know this, is that people get on plans and then they find out later that something has been dropped, or it doesn't cover a particular medication that they're on, or their doctor is not in network, and then it creates a crisis for them that has health consequences and financial consequences. So my question to you is, how should they factor their own health needs into making decisions around which plan they pick? And how do you guys work with them on that?
You raise a great point. If someone has experienced a healthcare or financial surprise, that's exactly what this time period right now. And if they've been on a Medicare Advantage plan and experienced a healthcare or financial surprise as a result of their plan, that's what this Medicare Advantage open enrollment period is for. It's for them to adjust their coverage before the end of the month. Now, what can you do to prepare so that there aren't any surprises? The first thing is to evaluate all your options. And there's no surprise here, because given where your viewer is watching this, they're going to have dozens and dozens of options. So it's really important that they evaluate all of them rather than just calling a captive insurance agent or responding to one of those mailers that they receive or an unsolicited phone call.
Right.
So instead, when you work with Chapter, you will go over your healthcare needs, which means your doctors, your drugs, and what's important to you. Those types of additional benefits that Kwame mentioned, like dental, vision, hearing, transportation, even over the counter. And that's going to vary plan by plan. But the fine print is where the rubber meets the road. It's really important that you choose a plan that won't have surprises, or at least if you know what those surprises will entail, if, for example, you have an unexpected hospitalization. And so that's exactly what you'll discuss in a one-on-one conversation with a senior Medicare advisor on our team.
Right. And if you want to work with Chapter, you can. I know Jerry's Morgan says, can I call Ari Consulting for? Well, there is a number on the screen that you can call, which is to Chapter Medicare 539-205-2147. And then in the description to this video, there's a form you can also fill out, and they will reach out to you. So one of the things that I get confused about when it comes to Medicare is that, they've made all these changes in legislation, and now Medicare Advantage providers are supposed to then send you a letter sometime during the year telling you that there is services that you haven't utilized and you should use it. So and it's a new thing that I think a lot of seniors don't know, that it's a big change that allows them to fully utilize, or at least take advantage of the plan they are paying for when it comes to Medicare Advantage. Can you speak a little bit to that and how that process works?
I'm so glad that you brought up this change, because for the first time, people are going to be alerted as to how much of the benefits they've used under their Medicare Advantage plan. So midway through the year, you ought to receive a benefit utilization letter. What this letter won't do is actually help you utilize your benefits, though, For this, you're going to need to have some type of high-touch, ongoing support. And so this is where I want to mention our member support team, which is here to help for any hiccups you have using your plan and to make sure that you get the most out of it.
Awesome. Awesome. Now, if you could give our viewers one piece of advice about Medicare, what would it be?
One piece of advice is to do your homework.
Okay.
And here's how. Prepare a list of your doctors, your drugs, and what's important to you about your coverage.
Mm-hmm.
So that way you have all your healthcare needs in one place. And that way you can use it to empower yourself when doing your research, whether that's by visiting our website, reading It's Not That Complicated, or by going to Medicare.gov.
Right.
Now, unfortunately, if your viewer goes to Medicare.gov with that list, they won't be able to check whether the Medicare Advantage plan that they're investigating has all their doctors covered. Unfortunately, that type of provider network information hasn't been married to Medicare.gov when you're investigating a specific plan option.
Mm-hmm. So I'm going to bring up your book again, since we're talking about it. It is not complicated. The 3 Medicare decisions to protect your health and money. And as I said, Ari is a known Medicare expert, and we're really, really happy to have him here. And one of the things that I want to shift before we end this conversation is to, we know that, 10,000 seniors each day actually, enroll in Social Security. And then there is the Medicare part of things that people have to consider. I put that in 3 different categories. People, some people are going to start taking Social Security at age 62, which is the earliest you can for most people. And then there is the decision around Medicare at age 65. Some people don't, most people feel they have to take both at the same time. If you get to 65, they feel the obligation to take Social Security and Medicare at the same time, but you don't. But then if you don't take Medicare, there's also I guess consequences around that. So there are a huge number of our viewers who haven't gone or enrolled in Medicare yet because of the age factor. So as they gear up to that, what should they be thinking about? And most importantly, when they make that decision and they're looking for an advisor, what should they be looking for in a medical advisor? I know you guys are in the business, but we want people to be informed about, we are bombarded with television. We're getting mailers all the time. People are hitting. And so if they are speaking to a medical advisor, what are some of the questions they should be asking as they gear up to enroll in Medicare when the time comes?
Make sure you're working with an advisor who can evaluate all of your plan options. And saying it isn't enough. It's about the how. How are they looking at all of your plan options? And how often is the advisor you're working with? How often have they recommended a plan that they don't earn any money from? Those are the 2 critical questions to ask your advisor. How do you search across all plan options? How do you evaluate what plan is right for me? And how often have you recommended a plan that you don't earn any money from?
Awesome. And somebody in Harris Friedman said, what about dual plans? So can you speak a little bit about dual Medicare plans?
Yes, this is a great question. Thank you for bringing it up, Harris. A dual special needs plan is a Medicare Advantage plan that coordinates benefits between Medicare and Medicaid. So if you're on a dual special needs plan, then it means that you have Medicare and Medicaid. And you can qualify for this by being below a certain income threshold.
Awesome. Thank you. So I know there's tons of questions that people have. Usually our videos then get a lot of, views after we finish the live. So I'm hoping that, once we, get all these questions in, at some point we can maybe bring you back to continue the conversation after this open enrollment period is over. But one of the things that I want you to leave us with, and I took some notes, which I want to, read back to the audience of what I learned today. Part of the 3 critical mistakes is, number 1, not missing your enrollment period. So if you're turning 65, it's important to know that 3 months before you turn 65, you have to enroll, or that is the window for you to enroll. And so that's important. That's the biggest mistake. The second one is that original Medicare only covers 80%. So we all hear that original Medicare is there, but it's important to know that it doesn't cover everything. And if you don't figure out a solution for the other 20%, it means that you have an exposure. There's a risk factor there. Yeah, you have to figure out. And Medicare Advantage plans are out there that can support you even with prescription drug coverage that takes you all the way. And then the third thing is not reviewing your coverage during open enrollment, which is October 5th to December 7th. So those are the three big
October
things.
15th.
October 15th to December 7th. Yes.
Yes.
So those are the big things that I learned. So any last words for us? I know that your company chapter, which we've partnered with, we talked about commission and I've been saying this on my videos. And one of the reasons we wanted to bring you here is that we've talked about chapter the last 2 months. We wanted to put face to the name, but also know that you guys are expert in the field. And so I hope that for our viewers, they can see that we are working with a credible company. But can you just close with a few things that our audience can think about, what sets you guys apart, and that if they call you or they fill out that form, they know that they are working with a trusted partner that can help them figure out what they need to do to get their Medicare coverage in the right place?
Yes. Remember when I mentioned our database helps you evaluate all of your options?
Yeah.
It also blinds our advisors as to which of those options Chapter earns money from and which ones we don't. So you can be confident that when you work with Chapter, you're evaluating not just all your plans, but also the one that's right based on your doctors, your drugs, and your priorities. And the only North Star that we have is making the single best fitting recommendation for the person that our team is helping.
Awesome. Awesome. Great. So, Ari, we want to really, really thank you for coming here and sharing this with our viewers. And as I said, this conversation can continue once this live is over. Just put the questions in the comments and we'll bundle them and send them and find a way to get answers back to you. So we want to thank you very much for coming here today and helping us unpack some of these Medicare questions as we gear up to the end of Medicare Advantage open enrollment, which ends on March 31st. So thank you for coming.
Thank you so much for having me.